Active sports enthusiasts often face the challenge of worn-out articular cartilage in major joints such as the knee and shoulder. Replacing worn articular cartilage has been and continues to be the holy grail of orthopedics. Dr. Rick Cunningham is a knee, shoulder, and sports medicine specialist with Vail-Summit Orthopaedics.
There's two types of cartilage in a knee. There's the meniscus cartilage or shock absorber cartilage between the femur and the tibia, and then there's the coating cartilage on the end of the femur and on the top of the tibia. Articular cartilage, I liken it to the white coating cartilage on the end of a chicken bone. We have it on the end of our bones as well.
In a complex hinge joint like the knee, the articular cartilage coating is just a thin layer 4 to 5 millimeters on the end of the femur or thigh bone and the end of the tibia or shin bone. This cartilage has a very low coefficient of friction, such that there is smooth gliding and sliding between the two bones, which allows for full joint range of motion. When the cartilage is worn down, the condition is referred to as osteoarthritis. The symptoms include joint pain, swelling, and decreased range of motion.
Osteoarthritis is caused by injury or aging. In my analogy, it's like the tread on a tire. You know, the more miles we put on, the thinner that tread wears, and so we all get arthritis with time. But people can also get it with a traumatic injury in which they tear ligaments, their meniscus, or even their coating cartilage when they have let's say an ACL tear or giving way tear where the knee shifts out of place.
For decades, orthopedists have used microfracture techniques to address worn cartilage in a patient. Dissatisfied with the results of this technique, Dr. Rick Cunningham found himself on the leading edge of recent technological advancements.
Microfracture is a technique that's been around for 25 to 30 years. And with microfracture, there's exposed bone in the knee where you've lost that coating cartilage, and a small pick is used to place little perforations in the bone. And from that, you get bleeding from the bone and resultant scar tissue that can heal a defect or fill that defect. However, when you get that bleeding from the bone, so-called stem cells from the bone, you see all stem lines grow in that defect. So you're going to see, in addition to cartilage, you'll see bone and fibrous tissue, and thus we call it a fibrocartilage mix. And you know, that mixture is not as good as filling the defect with pure cartilage. And there are some techniques today in which we can now fill the defect with primarily cartilage cells and cartilage regrowth.
Dr. Rick Cunningham is one of a few surgeons well-versed in an exciting new technique called ACI, or autologous chondrocyte implantation. ACI uses the patient's own cartilage cells to grow a new cartilage implant.
In ACI, we do an arthroscopic procedure in which we take a small biopsy of a patient's cartilage. We send it to a lab, they isolate the cartilage cells, and then they multiply those cartilage cells in culture. And then in the operating room, we get back this very expensive little vial of a patient's cartilage cells, and we're implanting them in a defect to basically grow, hopefully, a pure cartilage implant over that defect.
To determine if a patient is a candidate for ACI, Dr. Cunningham starts with a thorough patient exam and a high-resolution MRI, or magnetic resonance imaging.
I still do microfracture in some cases, but typically it's in a younger patient with a very small defect that might be hard to reach with an ACI procedure. Microfracture is done arthroscopically, and so we can still do a minimally invasive procedure and get some scar cartilage and a small defect. But in patients with a larger defect who are still active, I prefer ACI. I'm finding that the results are better with ACI than microfracture in those larger cartilage defects. Arthritis is a chronic process, and patients, have pain and swelling almost every day, and it's worse with activity. And so today we have ways of helping them with that arthritis pain and getting them back to the activities that they enjoy.